Okay, hello everyone, this is Dr. Jawad from Total Health Wellness Center. What I'm going to go over in today's video, very important, 12 symptoms of a thyroid problem that you should never ignore. So what is your thyroid gland? Where is it located? Thyroid gland is located in your neck, just right below the thyroid cartilage. It has two lobes on either side of the windpipe, and even though your thyroid gland is a small organ, it plays a big part on how the body works. So three hormones have to be released. Everything starts off at the hypothalamus gland. That's considered the master gland. So that releases a hormone called thyroid releasing hormone to your anterior pituitary gland, which releases a hormone called thyroid stimulating hormone, and then that sends a signal to your thyroid gland, which releases thyroid hormones to the target tissues. Now, very important, iodine in your diet is very important because that produces the thyroid hormone. So iodine is very important. So two primary thyroid hormones are produced. One is called thyroxine. That's a T4. That is 4 iodine atoms. That's inactive at first, but that gets converted to the active T3 in the body tissues. The other one is triiodothyronine, which is T3, and that consists of 3 iodine atoms. Now, the thyroid function, the thyroid gland has 3 important functions. One, increases your metabolism. Now, the basic metabolic rate is it's the way your body utilizes energy. 2, regulates body temperature. Regulates body temperature due to changes in metabolism. Okay? Also, 3, it regulates heart rate, which is driven by the metabolism. So remember, everything follows the breakdown of food products in the form of metabolism. So you ask yourself, why is it so important? Well, I'll tell you why. I'll tell you why because activity. If your thyroid is too high or too low, or if you have an autoimmune disease, okay, this is going to affect on how everything works. So if your thyroid gland is overactive, which makes excessive amount of thyroid hormones, you're suffering from a condition called hyperthyroid. If your thyroid gland is underactive, which cannot make enough thyroid hormone, you're suffering from a condition called hypothyroid. Okay? Now, there's this condition, it's an autoimmune condition, that means that your body's immune system is attacking itself. However, the target tissue is a thyroid. And that's called Hashimoto's thyroiditis. Okay? Now, that is not a thyroid problem. That is an immune system dysfunction, I should say, that it's attacking your thyroid gland. So what's going to happen, you're going to have hyper symptoms and hypo symptoms of thyroid function, okay? And that's all due to the immune system. Okay, so I'm going to talk about 12 symptoms that are early warning signs of a thyroid problem. Now, these are not in particular order, okay? So, number 1, feeling sad or depressed. Decreased serotonin production due to decreased metabolism. Now, serotonin, 80% of serotonin, which is our feel-good hormone, that's produced in the gut. 20% is produced in the brain. So if you have a low-functioning thyroid and you're not breaking down your food products, you're not producing enough serotonin. So this is where you feel sad or depressed. Symptom number 2, are you constipated? Now remember, thyroid hormone controls digestion. Decreased metabolism, bowel function. This is a very common symptom of a low-functioning thyroid. Hair loss and dry skin. Are your hair or nails brittle? Well, decreased hormone production interrupts the hair growth cycle. The most common symptom of a hypothyroid individual is the outer 2/3 of the eyebrows have been lost. And or dry skin and itching. Now again, decreased metabolism, slow thyroid, this is when your skin feels itchy. Or you're sleeping too much. Do you have a hard time getting out of bed? Remember, the thyroid controls a basic metabolic rate, which is the energy. So if you're sluggish, you have a decreased thyroid, which slows down the energy production of the body. Number 5, now again, this could mean a lot of things, so don't hang your hat on thyroid, okay? This is no sexual interest. This is one area, so due to low thyroid production, It decreases the production of low sex hormones. So if you have low sex hormones being produced, then you're going to have a low libido. Again, this is not a staple. This is just a symptom. Or sudden weight gain. Decreased metabolism, underactive thyroid, most common symptom. Now again, I got patients coming in and they put on about anywhere from 10, 20, 30, 40 pounds without even trying. Well, remember, the thyroid gland controls metabolism. So if you have a sluggish thyroid, this is where you're going to get the sudden weight gain. Okay, muscular pain or tightening. Now, I'm not talking about muscle soreness that you experience after a workout. That's normal. I'm talking about muscle pain and tightness. If you have mysterious tightening or numbness in the hands, arms, legs, or feet, this is abnormal, okay? A low thyroid hormone could damage the nerves that send signals from the brain to the rest of your body. And this could explain why you're experiencing tingles and twinges in, again, the hands, the feet, bilaterally, both sides. This could indicate something's wrong with your thyroid. Symptom number 10, fuzzy head. Now, you could have one condition where it's too difficult to concentrate. If that sounds like you, then you have a condition called hyperthyroid, where your body's producing too many thyroid hormones. Okay? Or you're on the flip side, you got brain fog, you're forgetting everything. Okay, this is what I get this too from a lot of my patients. They just feel like something's wrong. What's going on is they're producing too little thyroid hormones. Number 9, fluttering of the heart. No, I'm not talking about fluttering the heart because you're in love. Okay? That's something else. I'm talking about because thyroid hormones control the heartbeat. So if you have heart palpitations, okay, it regulates heart rate. If you have heart palpitations, this could indicate that you're producing too many thyroid hormones flooding your system. Okay, very important, high blood pressure. Remember, one of the functions that the thyroid hormones do is controls heart rate through metabolism. Thyroid hormone, heart rate, excessive hormones, okay? If you have an underactive thyroid, this can cause high levels of the bad cholesterol. Now, if you have bad cholesterol circulating through your system, this could lead to enlarged heart or even heart failure. Symptom number 12, increased appetite or changes in your taste buds. Remember, again, this is all metabolism based. So if you can't stop eating and don't gain weight, okay, you're lucky. So this could indicate an overactive thyroid that could be the problem, okay? Or if things taste differently. Now again, changes in taste happen over time, but if things just don't taste like they used to, this indicate an underactive thyroid, because an underactive thyroid can affect your taste buds and smell. Symptom number 12, very important. If you have a neck or throat discomfort, remember, your thyroid gland is located in your neck, okay? So if you have a lump in your throat, change in your voice, or even a goiter, look at your neck in the mirror and notice anything different. Tilt your head back. Observe in the mirror, tilt your head back. Take a drink of water and swallow. Check for any bulges or protrusions in this area, because if you have an enlarged thyroid or thyroid nodule, you may need an evaluation, okay? So if you're experiencing any of these 12 symptoms, or know somebody who's experiencing any of these 12 symptoms, please give me a call at my office, 630-653-2225, or look at my website, www.totalhealth2page.com. Give me a call for a free consultation. Call now, and thanks for watching.